I think we can start with the session.
Okay, thank you, sir. So, a very good evening to one and all attended today's class. I wish you a very happy International Women's Day to all the beautiful women who join us, and to the men also, because we are a combination of each another. So, before I start, I would like to share the detail about today's speaker, Dr. Rakesh Goria, sir. Dr. Rakesh K. Goria, sir, is an executive director at Medical Legal Institute and registrar at Baba Farid University of Health Sciences, Faridkot, Punjab. A faculty member of National Forensic Science University, Gandhinagar. He is a professor in Semi Arts and SJJT University, Rajasthan, adjunct professor at Internal University, Himachal Pradesh, and formerly faculty member at the Forensic Medicine Department, College of Medicine, Prince Sultan bin Abdul Aziz University, Saudi Arabia, and former principal at NC Medical College, Panipat, and Rama Medical College Hospital and Research Center, Kanpur in India. Due to his untiring effort to develop forensic nursing science in Indo-Pacific region, for the last 21 years, he has been awarded two titles, Father of Forensic Nursing, during an international conference on transforming perspective of nursing research and leading to the clinical innovations at Samarpan Institute of Nursing and Paramedical Sciences, Lucknow, and founder of Forensic Nursing in India at 9th Conference of Indo-Pacific Academy of Forensic Nursing Science at Durgapur, West Bengal, India. Sir is a BSc, MBBS, MD, PhD, and a diplomat of the National Board. He was a faculty member of Forensic and Legal Medicines at the Royal College of Physicians, London. He has four fellowship from the Indian Academy of Forensic Medicine, International Medical Science Academy, Indian Congress of Forensic Medicine and Toxicology, and Society for Prevention of Injuries and Corporal Punishment. He has completed the Quality Management System Lead Auditor course in ISO 9001 2008 standard from Moody International UK. He is the founder president of Pacific Academy of Forensic Nursing Science, Indo-Pacific Academy of Forensic Oncology, and Society for Prevention of Injuries and Corporal Punishment, and past president of the Indian Academy of Forensic Medicine, and founder president of Punjab Academy of Forensic Medicine and Toxicology. Sir is a former editor-in-chief of the Journal of Indian Academy of Forensic Medicine and Journal of Punjab Academy of Forensic Medicine and Toxicology. Besides that, he is being office bearer of many other organizations. Currently, he is editor-in-chief of the International Journal of Ethics, Trauma and Victimology, and editor of the Global Journal of Nursing and Forensic Science. He is a member of the advisory committee of the Journal of Indian Academy of Forensic Medicine, the Global Journal of Nursing and Forensic Studies, and German Journal of Forensic Science. He has presented 160 papers at national and international forum with 156 research publication. Out of that, 35 in forensic oncology and 12 in forensic nursing science. He has authored 3 books, that is Practical Aspects of Forensic Medicine, Forensic Nursing Science, a Global Health Initiative for Developing and Developed Countries, and Basics of Forensic Nursing Science. And he has authored 7 chapters for the 7 different books. He has 40 years of teaching experience. He has guided many MD and PhD scholars. He has 2 national and 2 international awards to his credit, and has delivered more than 60 keynote and guest lecture all over the world. He was given a special award by the Indian Academy of Forensic Medicine for his efforts to develop forensic nursing in India, a Vision Award by the International Association of Forensic Nurses at Salt Lake City, USA, an Excellence Award by the SFCCO College of Nursing, and 4 Lifetime Achievement Award by the PFMAT IASR at IAFS 4th International Forensic Science Conference at Delhi University. IJHRLMP and Headquarter Post Lifetime Achievement Award by IAFM2. His excellence academic area of special interest at forensic nursing, forensic oncology, and prevention of crime against children. He has rich international experience delivering keynote and guest lectures in 21 different countries, that is the UK, excuse me, UK, the USA, Switzerland, India, Pakistan, Sri Lanka, Peru, South Africa, Australia, Egypt, Iran, Turkey, UAE, Kingdom of Saudi Arabia, Belgium, Sweden, Sri Lanka, Nepal, Nigeria, Philippines, and Italy too. So with the huge experience and lot of things about this, sir, I just expressed to you all. Sir is today's guest speaker for us. Let me minimize this and stop sharing.
Today, I will like to talk to you about a very important thing, that is the forensic sciences and how is related to the medical sciences, and the forensic science laboratories, how they are constituted, what they do, where they are. And we will talk about all these things. I am from the Baba Free University of Health Sciences, and my salute to all of you from this university. And today, what we are going to do is we are going to talk about what is forensic science, what is the history of forensic science, what is healthcare practice, and what are the components of forensic science, where, when, and how we, why should it be used in healthcare practice, and precautions needed in using forensic science. And we will talk about the forensic science laboratories. So if we talk about the forensic science, it is any science when used for the criminal justice system. And in other words, if we say it is the application of scientific methods and techniques to matters under investigation by court of law, and especially collection, examination, and analysis of physical evidence in the forensic science. So some examples are of anthropometry, when we measure the different parts of the body, we measure the bones, and then there is the dactylography. We talk about the fingerprints, and the latest in this is the DNA profiling. These are just the examples. And if we talk about the different branches which are most concerned with the medical system, is the forensic medicine, where the forensic pathologist is there, forensic medicine experts are there, our clinical forensic medicine experts are there. And we talk about these different things, what comes in the forensic medicine. Forensic pathology is mostly concerned about the pathology of the tissue. It is concerned with the postmortem examination mainly. And then we also talk about the poisoning, and that is comes in the forensic toxicology, all aspects. Forensic anthropology, again, it is the measurements of the different parts of the body, the bones, and so many different things. And forensic psychology, what the psychology behind the crime. So all this comes in these branches. Forensic biotechnology, what the biotechnology people are doing, whether they are making the vaccines, where they are doing the stem cell experiments and the gene experiments. And forensic psychiatry, if the person is having some psychiatric issues, whether he's responsible for doing the crime when he is suffering from the different illnesses. And of course, it is your forensic nursing science. That is also one of the branches of the forensic sciences. And then the forensic odontology is there, when the different things which we can see from the teeth, that what different, how we can use the samples from the odontology for the investigation of the crimes and for solution of the criminal cases. Forensic podiatry is about the shoe prints, footprints, and about the gait of the person. And forensic DNA analysis, that is the ultimate thing, which is now topping all the list of all other things. So just like the fingerprints, you see there are the different types of the fingerprints. So from the study of this, now it is a computerized system. You have the fingerprint at the crime scene, and then the person is caught, whether we want to see whether it is him or not. Then we compare the fingerprints, and they have the different types, loops, whorls, and arches, and the composites, a combination of all these three that may be there. Then from this, we can find out whether the person is there. It is a very good science, and that is the most commonly used for the identification. And forensic podiatry, I just given you the examples of these two. So you see on the left, these are the shoe prints, and on the right side, what you are seeing, these are the footprints from the crime scene. And from this, we can identify the person who has done the crime, and these prints have been left at the crime scene. So there are other branches of that is for the forensic science, that is about the trace evidence analysis, about the forensic botany, a person is drowned and we see whether the items which are present there, whether that belong to a particular pond or that does not belong to a particular pond. And then there is a forensic engineering, two vehicles are colliding with each other, and then that helps that who is the culprit in these circumstances. Forensic linguistics, the person is speaking something, but and how that is going to help in the identification of the criminal. Forensic geology is there, forensic archaeology is there, when it depends on the fossils which are from the very long time old. And then the most modern thing is the digital forensics, and forensic ballistics is concerned with the arms and ammunition, and cybercrime of course is there. So digital forensics and cybercrime, they are going hand in hand, and now the future is about these two, digital forensics and the cybercrime. And forensic entomology, from the insects which are present on the dead body or from anywhere which we see on the body. So we can say from how much time has passed since that's from forensic entomology. And if the body has been brought from some other place, then we can also find about this. So if we talk about the history of forensic science, its importance lies in the ability to provide objective evidence. So that is very, very important. That evidence should always be objective, that can be used in the course of law. And from ancient times to modern era, forensic science has evolved significantly and became a crucial tool in the criminal investigation. So if we talk about, it is not a new science. In the China, there is a history of 221 BC that there were early use of fingerprints, what we call it dactylography. Chinese officials used fingerprints to seal the documents. They must have some system by which they were using the system. And in China, in the 3rd century BC, the first recorded autopsy by Songxi, a Chinese forensic expert, that was done. So it is mentioned in the history. And in the ancient Rome, forensic techniques to solve the crimes, such as examining blood stains and wounds, that were also there. And the nurses were giving the opinion at that time for the importance in the particular case by directly watching the performance. So in the Middle Age, the growth of the scientific methods in Europe during the Middle Ages, that took a lot of progress. First, what they used to do, they used to do torture and get the confession from the criminals, and that was the only part of the investigation. In India, it was also being used very commonly, and maybe sometimes it is being still used somewhere. But the development of forensic techniques, that has helped a lot. And now even the Bharatiya Nagrik Suraksha Samhita under the 176 code. So in that section, it is mentioned that all those cases where the punishment will be more than 7 years, then the forensic evidence is going to be must. So that tells you that how many cases are there. In all those cases, the forensic evidence is needed. So all the forensic people demand is going to rise in the days to come in the India. In the 18th century, so that was when the poisoning came, discovery of poisons were there, and so it started as a separate discipline. And Matthew Aufila, he was known as the father of the toxicology, published work on the detection of poisons and their effects on the human body. So in the earlier 20th century, establishment of crime laboratories, creation of the first forensic laboratory was there, and introduction of the systematic methods of analyzing evidence. Dr. Edmund Lockhart developed the Lockhart exchange principle. So this is very, very important principle. They say that when two things come in contact with each other, they leave some evidence on the other object. So they leave the traces, and these traces are studied by the forensic science, which helps in the investigation of the crime and solving the crime. And the first forensic lab was set in Lyon during that period. And in the late 20th century, in the 1985 year, the year 1985 and onwards, the DNA fingerprinting that started, initiated, and reached its full strength. And now there is a computerized system by which this we can compare the DNA fingerprinting. So it is DNA profiling actually. So profile of the criminal, profile of the stain which is seen from the crime scene. So they are matched, and we can say yes, that particular person was present at that place or not. So now there is so much advanced computerized fingerprinting, DNA fingerprinting, and so many other things are there with the advent of the computers. So everything is going advanced, and now with coming of the artificial intelligence, everything is going to change in the future. So now the crimes are cyber crimes, and all the data that is coming from the mobile phones, laptops, and these are being studied. Even if the person tries to erase it, then it can be uh, retrieved, and all the crime can be investigated in this. So in the future, artificial intelligence is going to take a big part, and machine learning is becoming a big thing, and probably so many things in the forensic science, like age determination from teeth, or so many things they are going to be solved by this artificial intelligence. And if we talk about the now application of the forensic science to healthcare practice, we must know what are the different types of the arenas where this forensic science can be applied. So usually we have this four systems: primary healthcare system, secondary healthcare services, tertiary healthcare services, depending upon the facilities, and the public health services. And if we see the healthcare practice, it can be outdoor, indoor, it can be daycare, it can be long-term care, it can be social care. And if we see the different persons who are involved in this, there can be the doctors, they can be the dentist, they can be the pharmacists, they can be the nurses, they can be like lab technicians, midwives, and physiotherapists. So all these persons, they need to know about the forensic sciences. So in India, the branches which are still in infancy, that is the forensic odontology and forensic nursing science and forensic pharmacy and forensic physiotherapy. Very, very limited things are being done in these branches. And if we see what is being done in medicine, so what the doctors are doing, you must know. So that we have to study this and see forensic nurses where they can join them, where they can be a part of the team, where they can work independently, and how best they can provide the services for the solution of the crimes. And so in the doctors where they are using in the identification, they are using in the forensic pathology, they are using in the clinical forensic medicine where they are injury cases, sexual assault cases, pregnancy, abortions, in forensic psychiatry. If we see about the identification can be full identification, or identification can be the partial identification when we know the absolute identity of the person. That is a complete identification. We know, yes, you see, he is Mohan Singh, he's living in Sarabanagar, he was in so and so, he's the father of so and so, he's the son of so and so, he's the husband of so and so. So, and we know exactly the age of that person, we know the gender of the person, to what race he belongs, to what religion he belongs, what is the height and weight of that person, what is the build of that person. But sometimes we don't know the absolute identification. We know some aspects. We know he's the male. He may be in the age group of 60 to 70. His height is 4 feet 6 inches. His weight is 70 kg, and his complexion is wheatish, and clothes what he's wearing, we can find. We can see whether the hair are gray or black or brown, or what type of. So birthmarks help, they are present, and the health moles are present on the different parts of the body. Sometimes the persons are having tattoos, but tattoos are not that useful, because similar tattoos can be found on so many persons. Scars, they are very, very important, because usually no two persons are the same scars, except if these are not the surgical. And sometimes there can be deformities, sometimes there can be so many differences in the teeth, sometimes the bite marks are seen on the persons. So blood groups are different of the different person, DNAs are different of the different person, fingerprints are of different in the different person. So if we know some facts, that is the partial identification. If we know the complete about the identity of the person, that is the complete identification. And usually complete identification is required, but if complete identification is not possible, we should do the partial identification. That helps in solving the crime. You can see this is a scar mark, different type. So again, this is a scar mark. that is a different side. So this is a nevus present. So these are the tattoos present. Again, you can see the tattoo present. So these are helping in the identity of the person. Some you can see this is the deformity in a person. There can be personal belongings. So the mobiles from this we can see there can be a pen drive, there can be diary, there can be glasses, there can be comb. From the comb even we can do the DNA. It can help in the DNA analysis. So there can be personal diaries, notes, so many things are which are helping in the identification if it is found at the crime scene from the dead body of the person. So then the doctors are also doing the facial reconstruction. You can see this is a dead body. How the face is looking like. If you give back the same to the relatives, so they will be so much distressed. But we try to do the reconstruction of the face. You see how the face becomes good, like we did the suturing, we did the artificial teeth, and we did so many things else that we can do the facial reconstruction. Similar is this case. So you see how ghastly this face looks like, but after reconstruction, yeah, the face becomes good in these circumstances. Pathology, we have to find out the cause of death in this case after establishing the identity of the person. In addition to so many things, the cause of death is to be found. You can see this is a ligature and this is a case of hanging. And in this case, a person has been shot dead and it is from the smoothbore weapon. And you can see this is a case of roadside accident. So in this, you can see this injury this old injury because the scab which had been formed that has already fallen off in this case. Again, this is a case of firearm. This is from a rifled weapon and this is from a smoothbore weapon. We can tell, yes, what type of the weapon this is. And in the case of sexual assault cases, so with the help of the colposcope, we can even see the very, very minor injury in the genitalia. And there are issues of pregnancy. Sometimes there is a suicide, sometimes there is a death, and we have to find out if there is a fetus that how much old that was, 1 month, 2 month, 3 month, 4 month, 5 month, 6 month, 7 month, or 8 month, or what month is there. So if sometimes the cases are brought, the person is living, we have to establish whether she is pregnant or not. So we are hearing the fetal heart sound when the fetus is 4 to 5 months old. Earlier than that, feeling of fetal movements at the 4 months are there. We see the radiograph of the fetus, then middle of the 4th month we can tell. If we do the ultrasonography at the 12th week, we can tell. And if we see the presence of fetal cells in the mother bed at the 5th week, we can tell. And then there are advanced imaging techniques. We can tell earlier whether a lady is pregnant or not. So if there are abortions are to be done, there should be done legally, and that is done according to MTP Act. So whether there is a risk to the mother, therapeutic, whether there is a eugenic abnormal fetus or humanitarian causes, why it is due to rape, social causes, and whether you see the contraceptive measures have failed, and if the mother is going to be distressed in those situations. So again, the MTP Act allows, and in emergency, of course, it allows. This act has been amended in the 2021. So several changes have been made, and so that we can give a safe abortion services, and we can reduce the preventable maternal death. First, the abortion could be done till 12 weeks by one doctor, 20 weeks by two doctors. Now 20 weeks by one doctor. Now can be done, and then 20 to 24 weeks again. Special board permissions have been taken, and more than one doctor that is required. And after that, the permission has to be taken from the court under special circumstances. In case of forensic psychiatry, sorry. The application of knowledge of various mental illnesses, their effect on the responsibility for various crime, and solution of various problems based upon this knowledge for the benefit of law. Because sometimes a person says that I am not mentally well, I did not know all this crime as I am not responsible for my crime because I did not know. So in this, there is a McNaughton rule. They say that to establish a defense on the grounds of insanity, it must be clearly shown that at the time of committing the crime, the accused was laboring under such defects of reason or disease of mind has not known the nature and quality of that as he was doing, or if he did not know that what he was doing was wrong. So this is used by the advocates uh, if their client is saying that he was not mentally well, and sometimes he's actually not mentally well, but sometimes he's just feigning, he's just saying to escape the punishment. So in these circumstances, that there is a role of a forensic psychiatrist and the forensic nurses in these circumstances. So they will, now we talk about the autopsy, postmortem examination. There is a big role of the nurses in this, and the doctors are doing now. Actually, the no dissection is done in the virtual autopsy, but it is a CT scan by which the different sections are taken, and ultimately the cause of death can be given in these cases. So in forensic toxicology or poisoning, so we classify poisons. We should know the signs and symptoms of poison. What is the uh, fatal dose or lethal dose, and how much time after the person is going to die? What are the findings of a particular poison if the person dies? Whether this poisoning was suicidal, homicidal accident, and how it can be detected. So all these things are taught. And ultimately, what you do, what the doctors do, they have to go to the court, and under oath, they have to speak the truth, the whole truth, and nothing but the truth in these circumstances. So all the things ultimately are going to be solved in the court cases, and we are going to present our evidence there. So similarly, as the doctors are doing, the dentists also help in the identification. They help in the disaster victim identification. They help in the facial reconstruction, superimposition and approximation. They help in the age estimation. They help in determining from the teeth we can find out the age. We can find out the gender of the person. We can find out if there are injuries are present. And all these things are ultimately going to help in the identification of the person, and the dentists are going to play a big role, because no two persons are they exactly similar, they are different, and this can help in the identification of the person. Sometimes in the sexual assault cases there are bite marks present, and from these bite marks also the individuals, they can be excluded or included, whether they did the crime or whether they did not do the crime. So these are the different types of the bite marks. So there are terrorist incidents where so many persons die at the same place. Then in these cases, the forensic dentist or the forensic odontologist, they are helping in the disaster victim identification. They also help in the age estimation. This can be done from the X-ray examination, from the bones, as well as from the teeth. And the forensic dentist, they help from the age estimation from the teeth. So similarly, the whether person is male or female, this can also be told from the teeth. And so the different measurement, they are different, and from the male and female, and from this the gender estimation can be done, and DNA can also help this. So sometimes you can find a skull and you don't have the person. So from that person skull, we can do the facial reconstruction, and you can see we from different studies we find out what is the thickness of the tissue at the different places, and ultimately we can make the face as it is on the right side. And from this is not the absolute identification, but that this can just give a clue. We put in the newspapers and they say yes, that particular person is missing, and this helps him resembling that person. And in this way this can be helpful. Then facial superimposition can be done. So on the photograph is there, the skull is there. So the photograph of the person and the skull of the person, they are X-rayed and they are superimposed upon each other. So there are dental trauma. We need to know, yes, now which section is going to apply, and if their teeth are broken or they are lost, dislocated, then it is a case of grievous injury. Even the biotechnologists, they are helping in farming the different types of insulins, interferons, cytokinins, and human growth hormones, vaccines, and manufacturing of antibiotics. And they are making drugs so that drugs can be more responsive. There's engineering for genetic defects, stem cell therapy, germline therapy, and gene therapy. So these are used by the biotechnologists. They help in the genetic testing for diagnosis of individual symptoms. Newborn screening is done. Prenatal screening is also done, so that no undeformed, so deformed babies are not there, so it can help in the gender determination too, and help in the identification. So they are also helping in they have developed the DNA profiling and the genetic fingerprinting. And so these are the different areas in which their services are being used. Another important field is pharmacist. So whatsoever they study how that can be applied to the legal issues for solving the criminal things and regulating in the manufacturing of the drugs, because they know about the acts, statutes, and rules. They know about the manufacture, storage, dispensation, licensing, responsibility, advertisement, whether that can be done or not, what should be the pricing, and how they should be dispensed, and if there is something wrong, how the drugs can be recalled, and how the narcotic and psychotropic substances are to be sold when they are needed medically, and what precautions they should take. And then there are physiotherapists. So pharmacy, they are not that much developed. And because they produce reports stating the facts and the assumption of facts of physiotherapy, they will give the opinion whether the matter will be defended or will be prosecuted, and they will assist the lawyers to understand the situation and ultimately give the evidence in the court of trial. So they will give on the opinion upon the personal injury, sport injuries and disability, sport pensions, criminal interventions, and public liability and negligence claim. So in forensic physiotherapy, they must have the knowledge in a particular subject beyond the average person. They deliver facts from the domain of their expertise, understand the relevant law, has credibility in the court, and role is to assist the court. So they must take care of the diagnostic rigor, surveillance, what is the public liability, and if something is doing wrong, there is a negligence or there is a malpractice and there is a discrimination, how to deal with those cases. And another very important aspect in the medical practices of the nurses, so that is the forensic nursing and all these sciences, all the things which are being used by other professionals, now it will be used by the nurses also. So whether it is the knowledge of forensic medicine, whether it is the knowledge of forensic science, and of course the nurses have the knowledge of the healthcare, and ultimately all this knowledge by the nurses, when it's being applied for the criminal justice system, that is the forensic nursing system. So you see, we are teaching the nurses about the at the postmortem examination, we take them and we teach them, and ultimately it is going to happen all over India. It is just the beginning. We are in the infancy in the forensic nursing, but it will gradually go to the different parts of the world. So in the emergencies, where first aid is given, the nurses can do the documentation of all the cases who are coming with the injuries. They can do help in the photography, as I shown you the different photographs. So they can help in the photography. They can help in the collection of evidence, because nurses have good communication, so they can establish a better rapport with the person, and they can be great help in the cases of forensic cases in the emergency. And in poisoning cases, they are also coming in the emergency. So they can do the documentation in all those cases. They can help in the treatment, and they can help in the preserving of the gastric lavage, which is done helping collecting the vomiting matter, urine samples, fecal matter, and clothes soiled by any of these, because this help in finding out, yes, what the poison can be there. And they can take care of all the legal formalities, so that doctors can give more concentration on the treatment of the persons. So in sexual assault cases, in the different countries, there are the sexual assault nurse examiners who are doing the examination of the case. They are doing the documentation, whatsoever is being done by them. They are collecting the evidence and they are presenting this evidence in the courts. Ultimately, one day, the nurses will be able to do that. In India, usually that is done under the supervision of the doctor. But what they will do, they will ultimately go to the court and present. So this is a very challenging and interesting field for the nurses who choose to select this field. If it fascinates you, that is very, very good, and it is a very good branch. And you can also be helpful. Forensic nurses can also be helpful in cases of criminal abortion, because nurses are usually the first responders in such cases. And the ladies go to the nurse rather than going to the doctor. So you can save their lives. You can prevent the death in such circumstances. And if it is some illegal abortion, you can also help to book the culprits in such cases. So you can also take care of the human rights violation, whether it is being done in jails, whether it is done in police stations, or anywhere wherever their custody person is in the custody. So there can be female victims. You can also take care of them. You can visit places of detention. You can do the surprise checks because you will be authorized by the government to do so. And by your continuous efforts, the human rights violation in prisons, in jails, and all at other places, you can help in decreasing those things. Forensic psychiatric nursing is ultimately going to develop. So you can see if the criminal is saying he is mentally ill, so then person is put under observation for 24 hours, 48 hours, 72 hours, and then you can determine whether person is feigning or actually he is suffering from the mental illness, because there are so many factors by which studying you can always tell about this thing. You can also work at the crime scene as a forensic nurse. You can be the part of the investigating team, and you can help in collecting the trace evidences, especially the medical facts. Because at the crime scene, there is a body gets stiff, there is a rigor mortis, or there is a discoloration of the body, or there is a cooling of the body. From that, you can always tell, yes, what is the time interval of the death, since how long the person has died. Because once the body is being transferred, so many artifacts they are going to develop on those places, and then the opinion which can be developed at the crime scene, so that sometimes that gets altered. So you will be the best person there to do this. So you will become ultimately detective nurses. So you can always say, yes, that this death is natural, this death is not natural, or whether it needs a postmortem examination. Because you so many natural deaths, then the postmortem examination will not be required by your expert evidence. So you can work in the insurance companies, you can verify the data there, you can we can save their money. You can work for the Consumer Protection Act, and you can guide the insurance companies in giving the right um, compensation to the right person, and can avoid the fraud also in those. You can be the part of the legal team. You, because you know, have the medical knowledge, you will have the legal knowledge also. So you can review the cases, analyze the cases, and guide the lawyers that what question they should ask, and where the case is weak or where the case is good. So you can help in framing the cross questions, and you can always be, because you have will have time, you can do the research on these things, you being the medical persons and the nursing professionals. So that is going to help you, because you will know more about the these human body rather than the lawyers and judges. So this is a sexual assault nurse examiner. These are the next sexual assault nurse examiners. I was just visiting in the Houston to their laboratory and see, yes, what they were doing and how they were doing to have first-hand knowledge. So if we talk about the forensic science laboratories, and forensic science laboratories, they are established and they play a crucial role in for the criminal justice system by providing scientific analysis and evidence in criminal investigation. This section explores the structural functions and significance of forensic science laboratories in India. And if we see the history and development, the forensic science in India has a long history. And because the first forensic science laboratory was established in 1952 in Calcutta, the director of forensic science services was established in 2002 to oversee and coordinate the forensic science services in country. And recently at the Muradabad, we had the privilege to meet with the director of the Forensic Science Services of India, Dr. Jain, and we discussed that how these things can be better utilized and what are the shortcomings, how we can improve the things in the country. And you being the part of now this forensic team, so because the most important aspect is collection of the evidence. If the collection of the evidence will not be good, then the forensic science laboratories will not be able to do a good job. If the collection of the evidence is good, then they will, with their help, the cases can be successfully prosecuted. So the development of forensic science laboratory has been driven by the need for the scientific evidence in the criminal investigation. And as I already told you in the Bharatiya Nyaya Suraksha Sanhita and Bharatiya Nagrik Suraksha Sanhita, 176 section, this says that now forensic evidence is needed wherever the punishment has to be more than 7 years. So the need of these labs is going to increase. So there are forensic science laboratories. Forensic science laboratory, there are at present 7 forensic science laboratories in India, and one of them is at Chandigarh. Another is at Calcutta, Hyderabad, Pune, Guwahati, Bhopal, and New Delhi. So these are the places where the forensic science center, CFSLs, or Center Forensic Science Laboratories are present. They provide a wide range of forensic services. So whatsoever different branches I have told you, almost most of the CFSLs, they are providing services in all of the, especially ballistics, DNA analysis, toxicology. These are the most common, but other things are also other services are also being provided, like for the cyber crime, digital forensics crime. So so you see now persons are using mobiles, the persons are using laptops. So they are either talking on this, or sending their emails, or sending messages, or using the social media for the crime. So whatever they do, that leaves trail on the mobiles and the computers. Even if their factory resetting is done, even then from this the data can be retrieved in all those circumstances, and they can know, yes, where the person has talked. So the trail of evidence can be there, and from that the person can be caught. Then another type of service is when each state is having its own lab. State Forensic Science Lab, Punjab Forensic Science Lab is present in Mohali. Similarly, each state has its own lab, and they cater to the needs of their state. Center Forensic Science Labs, they are pan-Indian, and they have their own area. 7 labs are there, so are divided the different parts of India where the samples are going, and all the samples of the state, they are going to State Forensic Science Labs. Usually, the CFS, they have more funds, they have more. So then it can be, they are doing this thing. And regional forensic science laboratories are there. Then in a state, the state may be very big, then the regional forensic science laboratories are there, and they work as a part of the state forensic labs, and they help to reduce the workload of the SFSLs. And then there are district level or at the local level, sometimes the mini laboratories are there. So mini laboratories, they are help to cater to the forensic needs of the specific districts or locality. They provide preliminary analysis and quick turnaround for the urgent cases. So they are doing the small test, and ultimately what they find useful, and they are sent to regional laboratories or the state laboratories or the Center Forensic Science Laboratories. There. So usually the director is there, and they are coordinating the activities of all these labs. And so there are laws, some state laws, some central laws, they work under those. And usually all these labs are collaborating and coordinating with each other. So some facilities may be present in one lab, some facilities may be present in another lab, because this requires a lot of money and a lot of experts. They may not be present. So wherever these are present, the samples are being sent to those labs. And so they do a lot of tests and lot which are being helped, which help in the solving the different types of the crime. And ultimately their reports, usually they are accepted as such, but sometimes if they need it, they can be called to the court. Usually their reports, they are accepted as such in most of the circumstances. And forensic science laboratories, they play a very, very good role in solving the crime, exonerating the innocents, and ensuring that people receive the justice. So you see, this is just a ballistic, where the So here the weapon is fit, and then it passes through this and it strikes this. And then at what was the speed of the bullet and all these things. So that is all studied, and the residues, what are there. So like bullet is fired, so that is producing the holes in the bone. So ultimately, the test fire and the crime scene bullet, exhibit bullet. So one is put here, another is put here, and then from the microscope we can compare and see whether it is fired from the same weapon or it is fired from the different weapons. Then there is now augmented reality and virtual reality is there. So that is helping a big thing. So it helps in the different types of crime scene, and here the digital images you can study in a very good manner as you see in your mobiles or on the laptops. And but this gives you a 3D experience, virtual reality. And so in the chemistry part of the lab, so this is the high performance liquid chromatography, and this is the gas chromatography with combo gas generator and gas chromatograph mass spectrophotometer and visible spectrophotometer. So these are the different types of instrument which are helping in the. Then there is a Fourier transform near infrared spectrophotometer. So all this help in the different types of testing of the sample. So this is a visit to a chemistry lab in Gandhinagar. So then there is a DNA lab. So these instruments are being used at the DNA lab. Now, if we see what are the challenges and the future prospects, so current challenges include shortage of trained personnel. So you know there is a shortage of trained personnel, and all those who will take the forensic science ultimately they will be absorbed in these different places. A lot of future is going to come for the forensic nurses, but at what speed we can move, that all depends upon us. And so technology is going to improve, training programs are going to improve, the funding is going to improve, and along with this, we can have the collaboration with the international forensic agencies and what are their best practices. We can use this so that we can get the very good results for India. And in the times to come, the forensic science laboratories are going to become indispensable because they provide the scientific evidence that is crucial for solving crimes and ensuring justice. And there is to be continued investment and development in the forensic science are essentials for a robust and effective criminal justice system. And sometimes don't think that whatsoever we do, we can undo fault. We can make mistakes, and due to which the person can be behind the bars. So now there has been an innocence project started in the Texas that if there is something, a wrong interpretation of the scientific evidence, then the person should not be behind the bars. So this project has produced so many exoneration because they proved that this test was not done in a right way, or it was done wrong, or the opinion was wrong. And because the samples are there, this can be tested at any times, and then the justice can be brought if somebody is doing it wrong due to one reason or the other. And there have been so many wrong convictions which have been overturned in the different cases because courts can always see, yes, this thing had gone wrong because it was improper forensic science. It was not validated. We should see that what we do, that is can be validated. And there is challenges of conveying the difference between causation and correlation. Correlation does not imply causation, yet conflating the two remains one of the most common errors. Invalidated or improper forensic sciences. So these cases have been exonerated. So the majority of the wrongful convictions were associated with ABO blood typing or secretor status. Maybe the person who is doing that gave the wrong or sample. Sometimes the samples are changed. Sometimes there can be so many different things, improper sample, and still the report is going west. So you can see how many forensic science and additional contributor factors they have produced the wrongful convictions. So these persons have been exonerated after serving so many times. But whenever you are using the forensic science in any medical field, including the forensic nursing science, you should be very cautious that whenever you are doing a case, you should take care that there should be identification, the consent of the person is taken, proper documentation is done, proper chain of custody is maintained, and everything should be unbiased, honestly done, and it should be truthful. And identification, we have talked a lot about all this. This should be person identification should be established before we are starting with the case. The second thing is that if there is a victim, till he gives the consent or she gives the consent, we should not proceed. It should always be expressed. She should know that what is going to be done to her, and she can say yes or no to that. It should not be a blanket consent that you can do anything with me, you can collect any sample. Everything should be told first to the patient, and then the yes of the person should be taken from this. And this, you should tell yes, what are the good things, what are the bad things about what you are going to do to the victim. And whatsoever the patient, you have informed the patient, and whatsoever the patient said, that should be written. And somebody should witness that you are some told the person and the person gave you the consent in front of somebody. That is it, witness consent. Whatever you do, you should document it, and it should be properly dated and time. It should be signed, stamped, and name written after the signature with your registration number on it. If it is, you have some registration number, because the doctors, nurses always have the registration number. But you have not documented it, so you have done a certain thing, but you have not written it, you have not made a record. Ultimately, the court will say you have not done it, even though you may have done it. So a good documentation means you have done a good work. And if you have not documented, it means you have done no work. Even it may be the vice versa. You may have done a very good thing, but you have not documented. But the court will not consider it. They will say you have not done it in a good way. So another important thing is the chain of custody. Whenever you hand over your samples to from you are a forensic nurse, you are going to handle a sample to the police, you must take the signature of the police. You see he's a police person, he's a forensic nurse. So you see he's handling the sample. So he's taking the signature, yes, I have received the sample. So maintaining chain of custody is very, very important. And if chain of custody is broken, then the whole exercise becomes useless. The evidence becomes useless. So if you wish to know more about the forensic nursing science, so this is a book available on the Amazon. You can study this book further. And if you wish to just have your knowledge about the your syllabus, whatsoever is there. So this is again a book, whatsoever I have done during these 20 years. So that has been put in this. So we are members of the Indo-Pacific Academy of Forensic Nursing Science who are giving you this course. So if you are interested in forensic nursing science, be the member of this Academy of the Forensic Nursing Science. And so this is a website. I try to go, maybe I can go to this website. Probably it is a it is a slow connection today, so probably it is not working. At any time you can go to this connection, you can go to this website, you can download the form, and you can become the member of this organization.
We will share
you
the
see,
website link in the
is
group, sir.
okay, we will send later in the group. So this is a journal. So if you are working, if you are publishing something, you can publish in this journal. This is a decade-old journal. It was in 2015, and now it is 2025. So 10 years of complete publication is there. So it is being supported by SPIC and in PAFNES. So there is no publication charges, and you can always publish your results in this. But whatsoever you do, you should be truthful. You should do it with honesty, and you should always be unbiased. So that is very, very important. So I would like to conclude that you should know the laws related to your field and you should follow it, know the legal issues related to your field and tackle it, and know to collect the evidence and do it in the right way. You should know to preserve the evidence, and because without preserving, so it will become useless. So you should know how to analyze the report and how you will give your opinion accordingly, and you should always be a man of science. So if you have any question, we can discuss. Thank you very much.
Thank you very much, sir. Thank you very much, sir. It was a very useful and informative session. Participants, if you have any doubts, you can post your doubts in the chat box. Sir will answer. Any questions?
But remember, I am not Google. Thank you very much.
But it was
and
very
bye
informative,
for
sir.
so
I
far.
know, I hope all the participants might have understood how much is there in forensic science and forensic nursing, forensic medicine now. Any questions?
So in the chat box, there are no questions. So thank you very much. And but still, if you have any questions, I will be very happy to answer it.
Thank you, sir. Thank you very much, sir, for a wonderful session.
Sir, I
I
would
think
like to say something if allowed, Jaideepa ma'am and sir.
yes,
So
ma'am.
if
Yes,
you,
please.
Yes, please.
because as sir is the founder of Indo-Pacific Forensic Nursing Science Academy, so I request sir, personally request that kindly let them know about the branches in your views. Though the class will be taken by the other speakers in later on, but here at this point, when you introduce about the forensic science, if you could have introduced about the branches in the forensic science and what are the availability in India, that would be very benefited for them, I think.
Pardon me, I did not get it properly.
Sir, I'm audible to you?
Yes, yes.
Okay. So I just requesting you that as you are a founder of Indo-Pacific Academy of Forensic Nursing Science, I request you kindly let them know about the branches of forensic science in India and what are the opening now. Recently, you opened so many things for the forensic nurses who pass out from the NFPU for them MSc nursing, MSc forensic nursing. So just let them know what are the branches are available in India about the forensic science for the nurses.
Yes, that's a very good question. Recently, a batch of 13 forensic nurses they have passed out, and six out of them were just on deputation. So they have gone back to their parent institution to help their institutions tackle with the forensic issues which were faced by them. 7 have been other nurses. So they are going to be employed by the various forensic nursing colleges, because now for starting the MSc, it is desirable that there should be MSc in forensic nurse. So there are about 2,000 nursing colleges, even if the 100 of them start with the forensic nursing courses. So then those will be required for the post-graduation courses. And still we are very short of the numbers. In addition to this, they can be we are going to employ the forensic nurses in the poison information centers, which is being done at the Baba Free University of Health Sciences. Shortly, we are going to employ many of them. And similarly, there will be at the police, they need for the crime scene investigation. The insurance company needs them to tackle with the fraud, financial frauds. So the advocates need them for framing their proper questions. The schools needs them to tackle with the child abuse cases. The old age homes needs them to tackle with the geriatric cases, geriatric abuse. So there are so many things. They are needed by the government human rights commissions so that they can go to the police stations, they can go to the prisons, and they say that there are no human rights violation in all those places. So there are so many opportunities coming, and even the private hospitals, they will need ultimately, they cannot pay so much for the forensic doctors to be present all around every time. So the forensic nurses, they can take that about the documentation and dealing with the medical legal cases. So there is a huge requirement of the forensic nursing in the times to come. I hope this has I am able to reply to your questions,
Yes,
what
yes,
you asked.
yes, sir. Thank you so much. Now I think that the participants, though they are not asking the question in the chat box, as everyone knows that forensic science or forensic nursing is a very new field for us in India, not in everywhere. It was previously, it was very well settled, but in India it is new, and now the people are showing their interest to learn about forensic science. I can see that we are
So there is
we
one
have,
question in the chat box.
yes,
So there is one question in the chat box. I will like to reply to that. So there
yes, please,
is
sir.
one. Is there any availability in forensic nursing in pediatric branch? Yes, this is a very good question. So because the sexual assault, child abuse, so they go around the pediatrics department. So in these cases, the super specialty will come for the sexual assault nurse examiner. Super specialty will be there when it will be there for the pediatrics department too. Any other question? I will be happy to answer. Ma'am, I think there is no other question, so we can wind up.
Yes, yes. Thank you so much. But Jaideepa madam, as we registered more than 400 candidates, it is 400 press, and there is only present up to 22. So we have to very stick with the course completion. So if you are not attending the classes, we will not be able to give them certificates. So that we need to put
Attendance
in the
is
groups.
marked, ma'am. We can take the attendance sheet in the Zoom platform.
Yes,
So
yes,
we
ma'am.
will compile the attendance.
That's great. And we'll put the message in the group also that if you're not present in the classes, then there is no use of being the part of this course. So we will not be able to give them certificates. And then all, thank you so much, sir. It was a brilliant class, as we are always be blessed to have you. And as you are our motivator and guide in the forensic science. Thank you so much for being here and giving such a brilliant upside about the forensic science today. And on behalf of all the team who have joined us and all the delegates and everyone, thank you so much, sir. Thank you so much. Thank you so much, everyone, for joining us in this fantastic course that is forensic nursing. And we'll meet again on 21st March with the beautifully planned class that is the team. With the Jaideepa madam is there. Yes, ma'am. Your class
Yes,
will
ma'am.
be
Yes.
at, yes, next class will be with you.
Kripa. Next class will be Kripa's.
Kripa ma'am on 21st March.
21st Kripa and 22nd mine.
Oh, so with 21st we'll meet again. Wish you are very happy for the
So
day.
there are few another questions coming. There are few another questions coming in the chat box. So I will
I
like
am
to
unable
reply
to
They are
see
putting
anything in chat.
they are putting you directly, as we cannot see any question in the chat box. So you can answer from
Okay.
your side. Yes.
So there is another question. After BSc nursing, how can we join into forensic department? You can always join the forensic nursing science MSc. So that will be the most useful thing to do. Our Baba Free University of Health Sciences is opening MSc in forensic nursing science, and National Forensic Science University has already started it. So there other colleges will also be coming up with the forensic nursing science in the month of July to come. So you can have a look at the website of the Indo-Pacific Academy of Forensic Nursing Science. We will be continuously updating those. And then there is another question, sir, is there a scope for substance abuse in forensic science? Yes, of course, it is there. So the identification of the substances with the chemical laboratory, so they are always doing it. So there is a big scope. So these were the two another questions. And thank you very much for the patient listening. Thank you for giving me this opportunity to share my views with you. Thank you for joining our course, and I hope this course is going to be very, very useful to all of you. Thank you very much.
Thank you, sir.
Thank you, sir. Thank you.
Thank you, Jaideepa madam. I think that we can now bind up with this.
Yes, ma'am. Thank you. Bye.
Bye. Take care. Have
Bye.
a very good night.
So I take the permission to leave, ma'am. Thank you very
Yes,
much.
yes. Thank
you,
you,
sir.
sir.
Thank you.
Thank you, sir.
Dr. Deepthi, for doing all this wonderful hosting. Thank you very much.
Thank you,
Thank
sir.
you.